And welcome for coming to our 2026 kickoff of the UAB Regional Consultation Hub for Precision HIV Implementation Science. Um, uh, it's nice to see so many familiar faces and names, and we really hope that this session will give you a clearer understanding of our hub and our services and expertise that we offer to the HIV research community and partners who are engaged in implementation research. We're going to have time at the end for questions, but please feel free to add them in the chat. And so just to introduce our role in advancing implementation science, I'm pleased to turn it over to Renee Heffron, who is one of our MPIs and overall hub lead.
Great. Thanks so much, Ann. Thanks so much to everybody for being here today. We were excited to have this session today, just really to introduce people to what we're doing in our implementation science hub. You can go to the next slide.
Okay.
So we really, when we think about implementation science, I think it's a field that not everybody is as familiar with as they are maybe about clinical research or clinical trials. So implementation science is defined in many ways, but one definition is that it's the scientific study of methods to promote the adoption and integration of research findings and evidence-based practices and interventions. And so you promote these and you get them into routine healthcare practice and public health settings to really improve the impact on population health. It's meant to accelerate the research to practice timeline, and many studies and articles talk about the average of 17 years that it takes for a novel treatment or a novel therapeutic to reach clinical practice. So there's clearly lots to do to reduce this timeline. Implementation science includes lots of different research designs. Some of them are effectiveness studies, implementation studies, demonstration projects, program evaluation. All of those and more contribute to this landscape of implementation science. Often in this science, we're focusing on identifying and addressing barriers to access, and we're considering a fully whole rounded perspectives of users, providers, community, and social factors that influence whether somebody uses a new product or not. Importantly, it's research that's conducted with rigor. Often we employ randomized designs, also mixed methods, and very often it's grounded in theoretical frameworks. Next slide. So I wanted to give just an example from HIV that I think we are all probably familiar with. These are the data, from the landmark HPTN 052 trial. It's almost 15 years now since we knew that when people use ART and have sustained use with ART and are virally suppressed, it works. It reduces both for disease progression, but it also works to reduce the transmission risk. This trial showed a 96% reduction, but we now have, this was the basis for U=U and tons of campaigns after that to really promote ART not only as a treatment, but also as a preventive option. Next slide. When you put this into practice, these are data from 2016, this systematic review that looks at large community-based trials of treatment as prevention. When you put this into practice, here, instead of seeing a 96% reduction in HIV incidence, seeing things like 31%, 30%, no effect. Right? And there's lots of reasons behind this, but it's implementation science that helped us to dive into this difference and really understand why we didn't see the same effect at the population level that we saw at the individual level, and then test strategies and things to do about it. So this is the sort of an example of why we need implementation science and what we use it for. You can go to the next slide. So our hub is focused on HIV implementation science and really growing and expanding the expertise of others in the region with this. We have a big team. People are focused on leadership and growing our different aims and different strategies that you're going to hear about. And then we have been able to pull in experts from around both the university and also the HIV/AIDS service organizations across the states to really round out our expertise in implementation science. Next slide. So this hub, there are a number of HIV implementation science hubs around the US that are funded through the same mechanism at NIH. And so our hub really specializes in the HIV epidemic in the US South, especially in the Alabama, Mississippi, Louisiana region that some people refer to as the Deep South. We also specialize in academic and public health department collaborations, how to initiate them, how to sustain them. And we have a specialization in social determinants of health, conducting implementation science in clinical spaces as well as community-oriented spaces, and then in community-engaged science as it can work with implementation science. And we have been a hub for about 5 years now. And so we've got a number of experiences working with different investigators across the country and in the region. We've supported 28 different projects that have been funded through the NIH using the EHE dollars. There have been over 125 consultations that were delivered by our hub leaders. More than 2,000 people who have been reached through our seminars and workshops. We convened the National EHE meeting in 2022, which brought about 400 people, both in person and virtually. And we have generated peer-reviewed papers and follow-on funding ourselves, and also from all of the investigators that we've been fortunate to work with. So I'm going to turn it over now to my co-lead, Dr. Robin Lanzi, and she's going to talk about some of the specifics about what we're doing with the hub. Oh, and also Larry Harold will also speak too. Thank you.
Yes. Good morning. Yes, so I was just going to say to that, thank you so much. Yes, and I'm joined by Dr. Larry Harold, who's Associate Director for our hub. And right now, I want to sort of briefly go over why us, why work with sort of the UAB hub, and what you can expect if you engage with us. Our core, as Renee was sharing, is really committed to providing precision implementation science support that is tailored to a project stage, setting, partners, methods, and timeline. So really can begin early in the kind of conceptualization stage, as well as I've got this product or outcome, and I really need to think to the next stage. But I'll try to sort of give it as an example throughout my part here. So as you listen, maybe imagine an investigator who's preparing an NIH EHE-focused proposal to improve PrEP uptake through Y&Right clinics and a partnering health department, and then sort of moving into early implementation once funded. So here you see, really the 5 reasons investigators and partners tend to seek us out. First, as we've sort of said, we specialize in implementation science support, and really trying to tailor those recommendations to the realities of your setting and really maturity of your project, rather than sort of generic advice or guidance around implementation science. And one area that we are focusing a lot on with this new R24 is we're not a supplement as we had been before to the CFAR. So we are providing pre-award support in addition to the post-award support. So for pre-award, we're helping to sharpen the implementation science questions, aligning design and measures with aims, and building what we think as a feasible partner-ready plan for submission. And then for post-award, of course, we help with all aspects as we have with the implementation, adaptation, strengthening measurement in real time, and planning for sustainability and dissemination. Third, we have, and so excited to have our community leads with us as well, but talking about how we have embedded community and practice expertise as well. So feasibility is evaluated through those lenses as well. So realities, not just through an academic lens. And then fourth, we help, and we have leads here in connections to some national HIV networks, which we hope will really help inform and help with many aspects. And then as Renee was sharing, we are rooted in the U.S. South and bring a lot of expertise in that in our area here. Sorry, yes, next slide. So who we support. And as you can imagine, our target audience, and we want to be sharing clearly that not just investigators who have awards already, but those who are conducting HIV implementation science aligned with the EHE pillars. So pre-award, I have an idea, I'm trying to conceptualize it. We are here to help with those aspects. We engage community implementation leaders, including AIDS service organizations and community-based organizations, both to strengthen sort of partnership design and really looking at pressure testing sort of feasibility. Finally, we support early stage investigators and trainees through the structured learning opportunities that we are building to help support the newer stage, and we'll get into even as early as high school. Yeah. Okay, so love and many thanks to Anne for this wonderful sort of display of precision, what it looks like for precision implementation science support across the research life cycle. And so as you can see, this life cycle really shows how we think about precision implementation science support. From pre-awards, we often start with that concept and fit, and then move into the design and methods, and of course into proposal and partnership development. So we can help think through each of those kind of parts. And once a project is funded, the early post-award window is about implementation planning and readiness, followed by the implementation, adaptation, and of course dissemination, sustainability, and scale. So our approach is to tailoring begins with that sort of an initial meeting, and discussing ideas and concepts and trying to help clarify where you are with the project stage, what are some key constraints, partnership structure, and how we might offer support that might be needed. And then matching with those that would be aligned with our areas of expertise, or how the collaborations that we have, we can do warm handoffs. So setting a cadence based on need, of course, and when the deadlines are and critical milestones. So let's see. Yeah. Technical advising is our project-centered support. So it's where we work directly on the implementation science architecture of the study. That includes, of course, study design, theory, framework selection, implementation strategy selection and specification, implementation outcome and measures, and plans for adaptation and sustainability and adaptation. So this would be focused on the project and providing specific expertise on that. So pre-award, this often looks like clarifying whether the proposal is best positioned for a hybrid design, implementation trial, pragmatic evaluation, and aligning that choice with feasible sampling, data sources, and partner workflow. Post-award technical advising becomes more about looking at issues that might need refinement, strengthening measurement in the context of what is actually happening, and supporting some of those decision points and mapping cleanly to the aims. So intentionally addressing how the structural and social conditions might affect implementation and how we can support that. Yeah, I think that's good. And then coaching with this new R24, we've embedded coaching in the investigator aspect, and it's focused on the investigator and the investigative team potentially, but in a longitudinal way that we could support if chosen. Well, technical advising focuses on the project. Coaching focuses more on the investigator and the team as sort of building a coherent program of HI implementation science and scope. So team building, partnership development, key decision points, scholarly trajectory. So trying to set realistic next step for funding pathways, and in practice, coaching is where we help investigators align their current project with sort of a multi-year agenda, identifying mentorship and training needs, and mapping dissemination products and grant opportunities that fit with the investigator's career stage and sort of that system and constraints that may be there. Can be useful, particularly for early and mid-career investigators building their implementation science portfolio, and for sort of established investigators who are more pivoting into implementation science. Yeah. Larry?
Yeah, great. Thanks, Robin. Well, it's great to see some new and familiar faces. My name is Larry Harold. I'm an associate director with the UAB Center for AIDS Research and a co-investigator on this new and exciting project. And one of the things that we're excited that's kind of new to the hub, for those of you who have interacted with our hub before, are these conversation hours where we think this will offer kind of this more informal opportunity to interact and engage and ask and get answers to questions that you may have about projects. And this again can be sort of post-award, you're engaged in the project and you're running into some issues and you want to talk through how you might work through those issues, or you may have questions about, as I said, pre-award, how you're putting together a proposal. Could be any range of things, but the idea is that this represents this more informal, virtual opportunity to kind of come together and ask those questions in this virtual office hour kind of style session. These will be held the first Wednesday of every month, and our first one will be on February 4th, 12 Central Time, for those of you who might be interested in joining from a different time zone. Again, at least I think the original intent is for this to be more informal. Come with your questions. We'll hopefully have many people attending, and we can kind of use the wisdom of the crowd to get answers to your questions. Periodically, however, we also anticipate bringing maybe more topic-driven discussions for the group. So, for instance, knowing that one of the new developments with this hub is the focus on pre-award activities. Maybe we can organize some sessions that would focus specifically on those kinds of pre-award activities, what all goes into putting together applications and so forth. But again, we're hoping this provides another venue to engage folks, but also to kind of help move all of your science forward. Next slide. So this slide, I think, really kind of sums up nicely what Robin has already kind of covered. Is all the different services that this new version of the hub will offer. Robin talked about the technical advising. This is something that our hub has long done, and this is really kind of very much project specific. You have questions about your implementation outcomes, which ones are most appropriate. We can talk through those things. We all know that there is an overwhelming number of theories, models, and frameworks. How do you pick the best one for your particular project? So we're still available to provide that very specific kind of advising on your project. Robin also mentioned coaching. This is also something that we did in the previous iteration of the hub, but this is really a more comprehensive wraparound set of services. We know that the work doesn't end with that project that you're working on, and oftentimes, particularly for new entrants to the field of implementation science and early stage investigators, you're working on a career, not just a single project. And coaching can help you think through some of the longer term what that career may look like and how some of your research figures into that. And I mentioned before, conversation hours. This is a new offering for the hub. We're really excited about this to kind of complement the technical advising and coaching. Robin already also talked about the pre and post award. I think that the exciting thing to note here is that Whereas before, most of our attention was on post-award activities. We're really excited that with this R24, we're able to kind of offer more pre-award activities. So we think this represents a more comprehensive set of services and offerings for all of you. Next slide. So I think for those of you who may be interested in taking advantage of all of these services, this is how you can do so. As you can see, there's a link here that would initiate that process where you could submit a request to sort of have a consultation to get that kind of technical advising. Following that, I think we will have a kind of a brief conversation to make sure we understand kind of what the goals of your project are, where you're at in that process. Are you just early stage thinking about the aims? Do you have an aims page, but you're trying to think about how to sort of turn that into the sort of the scientific approach, but basically kind of clarifying some of the specifics of your project. And one of the reasons for that is we want to make sure that we're matching you with the right person or the right people within our team, so that we're sort of providing the most sort of appropriate and sort of aligned people with the particular project that you're doing. And from there, of course, we will then set up kind of a plan, I guess, for how to actually provide those service. What's the schedule at which we can provide them? What's going to work for you based on your timeline? And really kind of help flesh out kind of a more detailed plan to help kind of support the work that you're doing. I think that's it.
Okay, now we'll hear from on community and practice engaged implementation science with our colleagues Jean Hernandez from CALA and Larry Cowan from Selma Air. So Jean, take it away.
Hi, everybody. My voice is a little funny today. Probably I'm with the thousands of people with cold. Larry, do you want to take this one?
I can assist if that's something that you're needing, because I definitely don't want you to lose your voice if that's what's going on right now.
So you can read and we can talk about it, but the less that I can read, the better.
Okay, I got you. I got you covered. So for supporting community engagement, we are looking at as far as to provide expertise in community engagement in the implementation sciences, or to better equip you with those tools that you're needing for that. We're also looking to connect you with facilitate partnerships between investigators and community and with CBOs and ASOs. That is something that I know myself and Jean, we definitely have our hands in those communities in multiple different ways, multiple aspects, but also not with just our agencies, but with other agencies as well. We are also looking to co-create. If you're wanting to partner with people from the community, there are times where they're going to want to not just be a volunteer or a participant, they're wanting to give feedback as well. And they're going to want to also be recognized in the creation of your research or the project that you have going on. So you have to look at those aspects as well. We're wanting to be there in as far as you contextualize to ensure that the research reflects the community. Not, and I'm not saying this in a negative way, but we don't want it to be what you perceive the community to be, but the community in all aspects, the good, the bad, the ugly, the positive and negative, so that you can get a well-rounded approach on that. And we also want you to come back and share with the community, not just the individuals that participated, but the community in general, maybe at an ASO, maybe CBO at a CAB meeting or something along those lines, to show them that they are valued from beginning to end. Jean, if you could go from there.
Yes, thank you, Larry. And I agree with Larry was saying. When we talk about research, usually we think about the researchers, right? But we sometimes forget that in this case, HIV is a whole community and is being built by a lot of leadership, a lot of history, and a lot of community building. And that's why Larry and I are here. We're happy to be with Cypher and the Hub. And one of the things that brings a partnership and meaningful involvement is access to trusted community networks. When I think about that, I usually is more trusting, how you can build trust with a community that you don't know, right? Uh, so it's important to attend to an event. If Larry probably have an event and one of the hub, you don't have to go all of you, but maybe one of you can go and make presence, start to have those relationships. Maybe by the next time the hub say, you know what, we want to do our research, we want to present, we want to maybe have some participants from here. That trust will build and it will uh, be a result of more participation, because it's not only presence or attending an event, it's credibility, right? So uh, another one is peers, promoters, volunteers, advocates. We have a lot of people through the community doing an amazing job, and researchers can educate us, right? And what is going on. So there's a lot of meaningful, trusted relationship that we can build around research and establish a good relationship. Meaningful and deeper contextual understanding, they will be feeling safe. Safety is very important right now. A lot of people will not understand um, when you present yourself, if you are from a clinic, if you are from a government, if you are going to ask for someone to sign a paper, what that means. So having all those experiences, in this case with the Latino population or immigrant population, that maybe the language could be a barrier, how we can break those barriers so we can have a more understanding of the people we want to maybe study and meet them, where they are. When we are talking about the bidirectional capacity building, I think that I like that a lot. Usually, I'm going to put an example. We can learn from each other, and we can really contribute each other's and enrich, our life experience, our cultural backgrounds, and trust with the communities. When we want to strategize, we I did a, a survey with people living with HIV, LGBTQ, about language justice and access to care. But I don't know nothing about the methods, the tools. I mean, I know, but it's not my thing. And I'm thankful. I don't know if Donnie is here, but Donnie York is assistant teacher in the Department of Social Work. And he have a class with the students of social work at a master degree level, and they offered to do that for us. So it was a bi-directional win-win situation for the students and for us. We did the survey, but they put it, they review it, they ask us questions, and I'm gonna to present, and I that this is gonna be part of what we're going to do this year, because we intentionally want to say that there's a lot of things that we can learn from our communities, but nobody's doing it because sometimes we don't have that opportunity. So I'm here to say, hey, we're here. We want to have those opportunities and keep growing and have that also fair compensation. I think Larry and I are very intentional when we have going to different forums like this, and don't expect that everything is gonna be for free. Sometimes people need to have expenses of gas. Gas is very expensive. They sometimes come from work, from their home. Sometimes, have a meal or something. Meanwhile, you're doing a lot of questions, a focus group. It will be many meaningful, but also do justice for the expertise that people have. If we respect the researchers' expertise and years, right, of study, we need to respect the same time the expertise of the community and people living with HIV. And the co-authorship, I have seen so many, maybe Larry can say something about that, that we participate in a lot of research, and it could be even that we bring the people and we explain what is the research is about, and there's not even an acknowledgement. I know that the authors have to be the researchers, and that's how it has to be, but at some point an acknowledgement of even the organization of the people that help in the community is important to do that sometimes you forget about that, and I think it's important. That way people are more likely, I was on a study, look, they acknowledged me, I wanted to keep doing this. So things like that will help. I don't know if Larry has something else.
Thank you, Gene. And yes, I do. I think we pretty much mirror each other on a lot of the different aspects of ways of building a meaningful engagement with the community and partnerships. Definitely starting off with trust and respect. When it comes to trust and respect, trust is not always going to be given when you first meet someone. However, if you come in with your full authentic self and respect the differences, whether you agree with them or not, and take out all of your biases, whether internal, external, and all of those things, you can create that trust, or you can create and build that trust and that respect. In that aspect, you also need to know who the community is and who the gatekeepers are that can bring you in, because sometimes the person that brings you in, or the person that provides the access to the community that you need, will bring you in with the trust and respect that they already have. And that can either make or break not just you, but them as well. Looking at that and recognizing real people have real pressures. They may say, I can meet you this day, this time. However, God forbid something happens, something personal, something that literally takes precedent or priority of what is being engaged before. Being able to understand and respect that not everyone is going to be able to meet you at the exact same way that you need every single time. If they're still giving you the opportunity, reschedule, do different things, and meet them at the levels that they can meet you at those times if they can. Also, learn to align your priorities early and define what the fit is, because sometimes the person that brings you into that community may not be the person that fits your community. A perfect example of that would be years ago working with Karen Johnson. She wanted to do a research project with women, and however, she didn't have access to the women of a certain community. However, I did, because of the respect and trust that I had already had built with that community and other people. I was able to put her in touch with someone that could bring her into the community and give her access to the individuals that she needed for the research project. And because they knew me, they knew that that was a person that could be trusted. And it was an amazing experience. I've heard it from both ends. I heard it from Dr. Johnson. I've also heard it from the individuals that spoke in that community and gave their feedback. They loved it and were looking for more opportunities, and probably still are. But also, the main objective is creating a bi-directional learning and questioning space. Because just as you have questions that you need answered from them, they may also have questions for you, and not just questions along the research project, but other questions that they may be more comfortable asking you because you've built that trust and that understanding. And even though it's not on this slide, the authorship, sometimes that co-authorship gives them some tangible linkage to the project and the research, and seeing their name on it, whether it's just as a co-author or maybe in the research, but seeing that part gives them a onus to say, well, I was a part of this. Everyone in the world can see this. Now I can take this and go back to my community and say, hey, I was a part of this. You can be a part of the next one, or we all can be a part of it, as long as you see your name on there somewhere showing that it's an acknowledgement and a recognition of not just your information, but of who you are as your person.
Thank you, Larry. Now I'm going to talk about how, in addition to community experts such as Larry and Jean, we also have many folks within our hub who have experience with real-world practice-based IS implementation science. So we offer, based on their experience working with health departments and Ryan White clinics, clinic and public health-based implementation science expertise, which can include guiding adaptation of evidence-based interventions to clinic priorities, for example, workflows and capacity. And we can also help develop practical implementation science tools, including readiness assessments, surveys, and other implementation process measures. We also have connections to some of the HIV networks that are funded by NIH. Our colleague, Michael Mugavero, who is within our hub, also is the co-chair of CNIX, which, for those who aren't familiar with CNIX, it's a national electronic medical-based, record-based network that integrates clinical data from people who have HIV. So this creates strong opportunities to embed implementation science directly within care systems. And so Mike is also, as I mentioned, the co-chair of the Implementation Science Committee. So later I'm going to share an example of how the hub has supported a CNIX embedded study. And in the center is the ACTG, which is a clinical trials network. And here our role for the hub looks different than what it might for someone who's working with CNIX. So here our focus is going to be on building capacity at the clinical trials units, that especially the ones that will carry out implementation science embedded protocols. And Adia is one of our implementation science experts within the hub, but she's also the vice chair of the Implementation Science Steering Committee within the ACTG. So it really creates this natural pathway for our hub to work with the ACTG. We're also engaged with the Max-Wise combined cohort study through our colleague Miriam Collette-Kemp, who's the site PI at UAB. And here, her role would be to help investigators who may want to do a project within Max-Wise provide cohort context and feasibility and insight into whether Max-Wise data could be used for a study involving implementation science. So this, I'm not going to read through the bullets, but these are, again, very similar to what Robin shared about how we provide support to investigators. But I'm going to talk about a real example in terms of how we supported CNIX. So we had an investigator who had a study that was a clinic-based implementation science study using CNIX as a platform. And this person was examining how depression and other mental health conditions affect HIV care behaviors and outcomes. So during the concept development stage, the hub helped assess alignment with EHE priorities and feasibility within CNIX, and identified opportunities where electronic health records and patient-reported outcomes, PROs, could be used for this study. And then the hub consulted on study design and contributed to an R34 application that evaluated a clinic delivered transdiagnostic intervention. And so as this work moved forward from a pilot stage to see if there is feasibility to do it within CNICS. The hub helped through Mike in figuring out how to scale this up to a multi-site type study. So here we help to navigate within CNICS to make sure it's feasible and supported for this planning of this implementation trial through that. So, and the hub continues to provide ongoing support throughout. So the services that are provided through the hub they're going to vary based on the context of the network and of what the investigator is looking to study. So now I'm just going to pivot to opportunities and learning how you can engage with us, continue to learn, and stay connected. In addition to this kickoff seminar, we're going to have monthly seminars, and these are the ones that have been scheduled to date. And they include anything from foundational topics like implementation science theories and frameworks, and identifying strategies. And we'll later include other types of topics. So look at our website, which will update with additional seminars. In addition to seminars, we have planned future workshops and training activities that cover a range of topics that might be of interest to different audiences, from dissemination science and product creation to building these relationships that Larry and Jean just talked about with community engaged science, navigating academic public health department collaboration, and writing policy briefs and opinion editorials. And we will have training opportunities that we've begun to plan that start as early as high school students, getting students to understand what implementation science is and if it might be of interest to them, all the way through medical school engagement for implementation science training. And these are the various ways that if you want to take a picture of it, also we'll have it up on our website. You can email us for questions. If you have ideas or interests in connecting with us, we have a website that just got set up, established, and it'll continue to have more and more information available. We also have a LinkedIn page. And then as Robin and Larry mentioned, there's ways to fill out a consultation form that's also on the website. And also please join our listserv if you want to keep up with any of the activities and plans that we have in the future. And so I want to take this time to thank you all for joining us today and for your interest in our hub. We really appreciate your time and engagement. And as someone asked in the chat, we will have the slides available and the recording on the website.